So to administer oral medications, first you would gather up your equipment. You would check the medication order against the medical records. You would clarify any inconsistencies and check the patient for medical allergies. You would make sure that you wanted to know the actions, the nursing considerations, and the safe dose ranges. Also, the purpose and why you're given the medication. You also want to know any adverse side effects of the medication. Um, you want to move your medication supplies to the patient's room after you've verified everything. You're going to unlock the med drawer before you um, prepare the medication. You want to check the EMR again and get the proper medication. You're going to compare the medication label with the MAR. You're going to check for any expiration dates and perform the proper calculations. You're going to make sure that the expiration dates are good. And then you're going to administer the medication with water. Ensure that the patient has swallowed it before leaving. And you're going to assist the patient back into a comfortable position before you leave, and then perform hand hygiene. So to remove medication from a vial, you're going to gather up your equipment, check the medication orders against the medical record. You're going to check the patient for any kind of allergies. And again, you're going to want to know the actions and the nursing considerations, safe dose ranges, why you're giving the medication, and any side effects the medication could cause. You're going to move the medication system to the patient's room, unlock the supply system. You're going to read the MAR and select the proper medication. Compare the labels of the medication with the EMR, and again, check for any expiration dates. Make sure that the medicine's not expired. And then you're going to take an alcohol swab and clean the top of the vial. Allow it to dry, air dry. You're going to remove the cap from the needle. And then you're going to place the needle into the vial right above the solution. Careful not to put the needle into the solution yet. And you're going to inject the air into the space, not into the solution. And then you're going to turn the vial upside down. You're going to hold the vial in one hand and the plunger in another hand to draw out the medication. If you get any air bubbles, you can tap on the barrel of the syringe and move the needle past the fluid into the airspace to re-inject the air bubble back into the vial. When you have the proper medication into the vial, you're going to remove the needle and carefully replace the cap back on to the needle. And then you're going to check the medication that you have in the syringe, the amount of it. And then you're going to discard any excess. Make sure you lock up the med drawer and then perform hand hygiene. To administer an intradermal injection, you would gather up your equipment and check the medication order against the medical record. Again, you would check the patient for any kind of allergies and check for any inconsistencies. You'd want to know the actions and the nursing considerations and the dose ranges, why you're given the medication and any side effects that it could cause. You're again going to move the medication over to the patient's room. You would unlock the med drawer. You're going to read the MAR again to make sure you're selecting the proper medication. Compare the label with the MAR, and again, check for any expiration dates. You're going to withdraw the medication and lock the medication drawer before you leave it. When you reach the patient, you're going to perform hand hygiene. Make sure you identify the patient. Check the patient's name. Check their ID band, their name, have them state their name and their date of birth. I'm going to provide privacy. Scan the patient's ID band if that is policy. Put on your clean gloves. Assist the patient to a comfortable position for the site that you choose. Cleanse the site with an alcohol swab, circular motion from the outside in. And allow the skin to air dry. You're going to remove the needle or remove the cap from the needle. You're going to hold the syringe in the dominant hand between the thumb and forefinger. Hold the syringe at 5 to a 15-degree angle from the site, placing the needle almost flat against the patient's skin with the bevel side up. Insert the needle about 1/8 of an inch with an entire bevel under the skin. Once the needle's in place, you're going to slide your dominant hand to the end of the plunger. You're going to slowly inject the medication and look for the small wheel to appear up on the skin. You're going to withdraw the needle the same angle that you put it in. Do not recap dirty needle. Also, don't massage the area. Assist the patient to a comfortable position. Discard the needle in the syringe in a sharps container. Remove your gloves and perform hand hygiene. And then you're going to check for the patient's response to the medication within the appropriate time range. Look for any reactions. To mix medications from 2 vials into 1 syringe, you'd gather up your equipment. Again, check the medication order against the original order in the medical record. You need to know the actions and nursing considerations, the safe dose ranges, why you're giving the medication, and any side effects the medication can cause. Move the medication to the patient's room. You're going to read the MAR and be sure that you're selecting the proper medication. And then you're going to compare the label, the medication label, with the MAR. Check for the expiration date. And again, you're going to get the vial and clean it with a alcohol swab, allowing it to air dry. Remove the cap from the needle. Draw back the amount of air into the syringe that is equal to the dose of the insulin to be withdrawn. Pierce the stopper on the top of the vial with the needle and inject the air into the space, not into the solution. Withdraw the needle. And you're going to draw back the amount of air into the syringe that is equal to the dose of the unmodified insulin to be withdrawn. Hold the unmodified vial on a flat surface. Pierce to the stopper in the center with the needle and inject the air into the space above the solution, not into the solution. Invert the vial, and again, touch the plunger only at the top on the knob. Draw up the prescribed amount of medication while holding the syringe at eye level. Turn the vial back over and remove the needle. Make sure there's no air bubbles in the syringe. You're going to recheck the vial label with the MAR. You're going to calculate the end point on the syringe for the combined insulin amount by adding the number of units for each dose together. Insert the needle into the modified vial and invert it. Make sure that you're not, injecting medication into that vial. Draw up the prescribed amount of medication. Turn the vial back over and remove the needle. Carefully recap the needle. Check the amount of medication that's in the vial. And make sure you label the vials with the date and time. Opened date and beyond use date, and store the vials into the proper storage containers. To administer a subcutaneous injection, you gather up all your equipment, check the medication order against the medical record, check for any inconsistencies, check the patient's allergies, and again, know the actions, nursing considerations, safe dose ranges, why you're giving the medication, and any side effects that the medication can cause. Make sure that you read the MAR and select the proper medication. Compare the medication label with the MAR and check the expiration date. You're going to transport the medication to the patient. You're going to perform hand hygiene. Make sure you identify the patient. Compare the patient's information with the MAR. You're going to check the patient's ID band. Have the patient state their date of birth and their full name. Provide privacy. You're going to put on clean gloves. Select the administration site. Make sure you identify the appropriate landmarks for the site. You're going to clean around the area using firm circular motion from the outside in. Allow the area to air dry. Don't rub it or fan it. You're going to remove the needle cap. You're going to pinch up, skin fold. You're going to pinch up the skin fold. You're going to hold the syringe between the thumb and forefinger. You're going to inject the needle at a 45 or 90 degree angle, depending on the amount of tissue that you have. Once you have the needle inserted, you release the skin and stabilize the base of the needle with your other hand. And then you use your dominant hand to come back to the syringe. You're going to inject the medicine slowly. And then you're going to take the needle back out at the same way, the same angle that you put it in. And do not recap a used needle. Make sure that you dispose of the needle in the appropriate sharps container. Don't massage the injection site. And if, the site is bleeding, cover it with gauze. Then you're going to assist the patient back to a comfortable position and do your hand hygiene. And then you're going to make sure that you evaluate the patient for their response to the medication. And to administer an intramuscular injection, you again, gather up your supplies, know all the nursing considerations, safe dose ranges, why you're giving the medicine, any side effects that it can have. You're going to read the MAR again and make sure you're selecting the proper medication. Take the medication to the patient's room. You're going to identify the patient 2 ways, at least 2 ways. Check the patient's name and date of birth against their medical record. You're going to provide privacy. You're going to select your administration site, and you're going to clean it again with alcohol from the outside in. You're going to remove the needle cap. Then you're going to displace the skin in the Z-track manner. Pull the skin and underlying tissue down and to one side, about an inch, with your non-dominant hand, and hold the skin and tissue in this position. You're going to quickly dart the needle into the tissue, so the needle is perpendicular to the patient's body, which should be about 90 degrees. As soon as the needle's in place, you're going to move you're going to use your thumb and forefinger with your non-dominant hand to stabilize the syringe at the bottom, and then you're going to move your dominant hand up to the top of the plunger. And you're going to inject the medicine again slowly. Then you're going to wait with this one for 10 seconds. Once that's done, you're going to withdraw the needle the same angle that you inserted it. And you're going to recap the needle, place it in the appropriate sharps container, apply gentle pressure at the site with a dry gauze, and again, don't massage it. And then you're going to assist the patient to the position that they want and perform your hand hygiene and evaluate the patient for any changes or reactions they might be having. To apply a transdermal patch, you're going to check the medication order against the original order that's in the health record. Again, know the actions, nursing considerations, safe dose ranges, purpose of administration, any side effects. Perform your hand hygiene. Move your supplies to the patient. You're going to read the MAR and select the proper supplies or medication, and compare the medication labels with the MAR. Check the expiration dates. You're going to identify the patient again 2 ways. Have the patient state their name, date of birth, and scan the barcode on their ID band if that's necessary. Put on your clean gloves. Assess the skin on the patient where you're going to place the patch. Make sure there's no signs of irritation or breakdown. The site should be clean and dry. Also rotate application sites. Remove any old patches of the same medication that is on the patient's skin. Remove the patch from the covering and apply the patch to the patient's skin. Pressing firmly for 10 seconds, not massaging. You're going to initial and write the date and the time that you placed the patch. Remove your gloves and perform your hand hygiene. To administer eye drops, you're going to check the medication order against the health record of the patient. Know all your nursing considerations, the safe dose ranges, why you're administering the medication. You're going to perform hand hygiene. You're again going to check the MAR and make sure that you're getting the proper medication. Once you get to the patient's room, you're going to check the MAR again. Make sure that you check for any allergies. Identify the patient in at least 2 ways. name, date of birth. Put on your gloves. With eye drops, give the patient a tissue. You're going to cleanse the eyelids and the eyelashes if there's any drainage, just with a warm, wet cloth or cotton ball. You're going to tilt the patient's head back if they're sitting down, or place the patient's head over a pillow if they're laying down. You're going to remove the cap from the eye drop bottle, the medication bottle. Be sure that you don't touch any part of the eye to the container. You're going to have the patient look up and focus on something using the thumb and the 2 fingers nearest the margin of the lower eyelid, below the eyelashes. Apply pressure downward over bony cheek. You're going to lower the lower conjunctival sac is exposed, as is the lower lid is pulled down. Rest the lateral side of your hand on the patient's forehead and hold the dropper close to the eye, but not touching the eye, any part of the eye. Squeeze the container until the prescribed number of drops fall into the conjunctiva. Then you're going to release the lid after you put in the eye drops. You're going to apply gentle pressure over the inner canthus to prevent the eye drops from flowing into the tear duct. Instruct the patient not to rub the eye. And you're just going to replace the cover on the medication bottle. And remove your gloves and perform your hand hygiene, and then evaluate the patient's response to the medication as you would with any other medication. Administering an eye irrigation, you're going to again check the MAR, make sure you're getting the proper medication. You're going to take it to the patient's room. Make sure you identify the patient at least in your 2 ways. Complete all the assessments that you need to do before administering the medications. Make sure you check for allergies. You're going to put on your gloves, clean the lids and the eyelashes if there's any discharge or anything on there. Put on your face shield and your splash guard, and place the curved basin at the cheek on the side that you're going to be irrigating the solution. Place the thumb near margin of the lower eyelid, right below the eyelashes, and 2 fingers above the eye. Apply pressure downward to expose the conjunctiva, and hold the upper lid open with your fingers. You're going to fill the irrigation syringe with the prescribed fluid. Hold the irrigation syringe about 1 inch from the eye. Direct and flow of solution from the inner to the outer canthus along the conjunctiva sac. You're going to irrigate until the solution is clear or that all the solution's been used. You're only going to use enough force with the syringe to remove secretions from the conjunctiva. Don't touch any part of the eye again. Pause if the patient, pause the irrigation and have the patient close their eye every, little while you're irrigating. Dry up any areas, that may have gotten wet. You're going to remove your gloves, wash your hands, remove your face shield and splash guard, and again, evaluate the patient to make sure that they are not having any reactions to the medication. So to administer eardrops, you do all the same things that you do with all the other medications. Check the MAR, ensure that you are getting the proper medication for the proper patient. You're going to, before you administer the medication, you're going to identify the patient 2 ways, at least 2 ways. Perform your hand hygiene. Put on your gloves. Make sure you check for the patient's make sure you check to see if the patient has any allergies to the specific medication. You're going to clean the external ear with any drainage that may be there, just with a washcloth with normal saline or water. Place the patient on the unaffected side and have the patient sit with their head tilted to the side so that the affected ear is uppermost. Remove the cap from the medication bottle. Make sure you don't touch any part of the top to the ear. You're going to straighten up the canal by pulling the pinna up and back for an adult. You're going to turn up the bottle with the tip above the canal. Don't touch the dropper to the ear. You're going to squeeze the container and allow the appropriate amount of drops to fall into the ear. Avoid instilling into the middle of the canal so that it doesn't fall directly into the tympanic membrane. Release the pinna and have the patient maintain the head tilted so the medicine doesn't run back out. Gently press on the tragus just a few times. And then instruct the patient to remain lying down with the affected ear upward for about 5 minutes. Then you're going to replace the cap on the bottle. Remove your gloves, perform hand hygiene, and then just evaluate your patient. Now, to perform a nasal spray, again, all the same precautions that you do with all the other medications. Check the MAR. Be sure you have the proper medication. Check the patient for allergies. Make sure that you identify the patient at least in 2 ways. Have the patient state their name, date of birth. Check their ID band against the medical record. When you've ensured that you have the proper patient, the proper dose, the proper time, you're going to put on your gloves, provide the patient with some tissues and ask them to blow their nose. You're going to have the patient sit up with their head tilted back. You're going to instruct the patient that it's necessary to inhale gently through the nose as you're spraying the spray up into the nair. You're going to agitate the bottle, shake it up just a little bit if it's required. You're going to insert the tip into one nostril, close the other nostril with a finger, and have the patient breathe in gently while you spray the medication up. You're going to release the container from the compressed state. And then you're going to have the patient hold his or her breath for just a few seconds and then breathe out slowly through the mouth and then repeat in the other nostril. Wipe the outside of the bottle nose with a clean, dry cloth and instruct the patient to not blow his nose for 5 to 10 minutes. You're going to remove your gloves, perform hand hygiene, and evaluate your patient's response.